I was a cleaner fired without cause until I found evidence of their health code violations. And that's when Marcus Sullivan, the man who had mopped floors for 3 years without a single complaint, transformed into something far more dangerous than they could have imagined. The termination notice sat on my kitchen table like a death sentence, its corporate letterhead mocking me with false professionalism. Immediate termination. No cause given. Security escort required. The words blurred together as my hands trembled. Not from fear, but from a rage so pure it crystallized into something cold and calculating. Riverside Medical Center had been my second home for 36 months. I knew every corner, every hidden alcove, every place where the cameras couldn't see. I knew which doctors left their offices unlocked, which nurses cut corners during shift changes, and which administrators spent more time covering their tracks than doing their jobs. They thought I was invisible, just another uniformed body pushing a cart through sterile hallways. They were wrong. Dr. Patricia Hayes had engineered my firing. I'd seen it in her eyes during that final encounter 3 days earlier, when I'd accidentally witnessed her meeting with the pharmaceutical rep in the storage closet. Money had changed hands. Samples had been pocketed. She'd noticed me before I could fade into the shadows, and her expression had shifted from guilty panic to cold calculation. Now I understood why the security footage from that corridor had mysteriously malfunctioned. Why my access card had been deactivated without explanation. Why the HR director, James Morrison, had refused to meet my eyes during the termination meeting, his fingers drumming nervous rhythms on the conference table. The system had chewed me up and spit me out to protect itself, but they'd made one critical mistake. They'd forgotten that cleaners see everything. I spent the first week in my apartment, curtains drawn, subsisting on coffee and cold fury. The walls felt like they were closing in, but my mind was expanding, cataloging every detail I'd observed during my time at Riverside. The late-night maintenance calls to the morgue, the way certain surgical instruments were cleaned and stored, the shortcuts taken in the infectious disease ward. My laptop became command central. I created folders for each department, each administrator, each violation I'd witnessed. The evidence was all there in my memory. I just needed to prove it. The opportunity came through Linda Chen, a night shift nurse who'd always treated me with basic human decency. She'd texted me after my firing, expressing genuine shock at my sudden departure. I met her at a coffee shop 6 blocks from the hospital, watching her scan the room nervously before sitting down. She leaned forward, her voice dropping to barely above a whisper. Her words confirmed what I'd suspected. My firing wasn't isolated. The hospital was hemorrhaging money, and someone was selling medical supplies on the black market. Dr. Hayes wasn't just taking pharmaceutical samples. She was part of a larger network skimming from inventory and falsifying records. Linda's eyes darted toward the door as she slid me a small flash drive. Security footage from the nurse's station, partial but enough to show the pattern. She'd been collecting evidence for months, too frightened to act alone. I pocketed the drive without comment, but something shifted in my chest. The cold fury was crystallizing into something sharper, more focused. I wasn't just seeking revenge anymore. I was going to expose the rot that had cost me my livelihood. The preparation phase began immediately. I studied the hospital's organizational chart, identifying key players and their relationships. Dr. Hayes reported directly to Chief of Staff Dr. Robert Vance, who answered to CEO Margaret Thornton. The chain of command was clear, but so were the vulnerabilities. I purchased a small surveillance camera, barely larger than a button, and practiced concealing it in various locations. My janitor's uniform became my disguise. Gray coveralls purchased from a uniform supply store, identical to what I'd worn for 3 years. The hospital's vendor badge system was surprisingly easy to replicate, with the right equipment and a steady hand. The first reconnaissance mission was scheduled for Tuesday night. I waited until 11 p.m. when the skeleton crew would be focused on their rounds. The employee parking garage was poorly lit, and I slipped through a maintenance entrance that I'd propped open months ago, a safety violation that no one had ever noticed. My heart hammered as I moved through familiar hallways, but my hands were steady. Muscle memory guided me to the supply closets, the administrative offices, the areas where I'd observed the most suspicious activity. I installed the camera in the pharmaceutical storage room, positioning it to capture the entrance and the secure cabinet where controlled substances were kept. The footage from the first night was disappointing, but not surprising. Normal staff rotations, routine inventory checks, nothing incriminating. But patience was part of the strategy. I returned twice more that week, each time refining my approach, learning the new patterns of the night shift. On Thursday, the camera captured Dr. Hayes entering the pharmaceutical storage room at 2:17 a.m. She remained for 14 minutes, emerging with a small package that she tucked into her coat. The timestamp would be crucial, but I needed more. I expanded my surveillance to include the medical waste disposal area, where I'd previously noticed irregularities. The amount of waste generated by certain departments never matched their official patient loads. Either they were treating far more patients than reported, or materials were being diverted elsewhere. The breakthrough came during my 5th infiltration. I'd positioned myself in the ventilation system above the administrator's conference room, a space I'd accessed countless times during routine maintenance. The monthly budget meeting was scheduled for 3 a.m. when the hospital operated at minimum staffing. Morrison sat across from Dr. Hayes and 2 other administrators I didn't recognize. The conversation was muffled but clear enough to understand the scope of their operation. Medical supplies weren't just being stolen, they were being systematically diverted to off-site facilities. The hospital was billing insurance companies for procedures that were never performed, pocketing the reimbursements while providing substandard care. The patient mortality rates in certain departments weren't accidents. They were the inevitable result of corner cutting and resource diversion. People were dying so these administrators could afford vacation homes and luxury cars. My hands clenched into fists as I recorded their conversation on my phone. The audio quality was poor, but combined with the visual evidence from my cameras, it painted a clear picture of systemic corruption. I needed more evidence, and I needed it fast. The longer I remained undetected, the greater the risk of discovery. But I also needed to be strategic about the timing. A premature revelation would give them time to destroy evidence and scapegoat lower-level employees. The plan crystallized over the following week. I would gather evidence for 2 more weeks, then release it in a coordinated assault that would overwhelm their ability to cover up the damage. Local news, state health department, federal authorities, everyone would receive the same documentation simultaneously. But first, I needed to ensure the evidence was ironclad. I returned to the hospital every other night, varying my entry points and timing. The pharmaceutical storage room camera captured 3 more instances of Dr. Hayes removing controlled substances. I documented the serial numbers of medical equipment being moved to unauthorized locations. I photographed falsified patient records that showed treatments billed but never administered. The medical waste disposal area yielded the most damning evidence. I discovered that biological waste was being stored in a sub-basement area that wasn't included in the hospital's official floor plans. The containers were improperly labeled and stored in conditions that violated every health code regulation in the book. The stench was overwhelming, a mixture of decay and chemical preservatives that made my eyes water. But I forced myself to photograph everything, documenting container numbers, storage conditions, and the complete absence of proper ventilation or containment systems. One photograph showed a container labeled as general medical waste that clearly contained human tissue. Another captured a storage area where infectious waste was stacked next to cleaning supplies. The violations were so egregious that a single inspection would shut down the entire facility. I uploaded all the evidence to multiple cloud storage accounts and created detailed reports for each category of violation. The pharmaceutical thefts, the billing fraud, the medical waste improprieties, the systematic neglect of patient care standards. But the most damning evidence was yet to come. During my reconnaissance of the administrative offices, I'd noticed that Dr. Hayes kept a personal safe behind a false panel in her office wall. It was old-fashioned, with a combination lock that had seen better days. I'd learned to crack similar safes during my younger years, a skill that had seemed useless until now. The safe contained exactly what I'd hoped: detailed records of the pharmaceutical diversions, including buyer contacts and pricing information. Dr. Hayes wasn't just stealing medication. She was running a sophisticated distribution network that supplied pills to street dealers throughout the city. The patient mortality statistics were even more horrifying than I'd imagined. The hospital's infection rates were 3 times higher than the national average, directly correlating with the substandard cleaning and sterilization procedures they'd implemented to cut costs. I photographed every document, every ledger, every piece of evidence that proved their systematic corruption. My phone storage was nearly full, but I kept shooting. Each photograph was another nail in their coffin, another piece of proof that would demolish their careers and expose their crimes. The final piece of evidence was the most personal. I found my termination paperwork in Morrison's filing cabinet, along with a memo from Dr. Hayes recommending my immediate dismissal. The reason listed was security concerns, but the attached documentation told a different story. They'd fired me because I'd witnessed their pharmaceutical meeting, and they needed to eliminate any potential witness. My hands shook as I photographed the memo. The betrayal cut deeper than I'd expected, but it also provided the missing link between my personal grievance and their systemic corruption. They destroyed my life to protect their criminal enterprise. Now it was time to return the favor. The execution phase began on a Monday morning. I'd chosen the timing carefully. Monday was when the hospital's administrative staff would be most focused on the week's objectives, least likely to notice subtle changes in their environment. I started with the health department. The state inspector's office received a comprehensive report detailing every violation I documented, along with photographic evidence and precise locations within the hospital. I followed up with a call to their emergency hotline, reporting immediate health hazards that required urgent intervention. The local news stations received their packages 30 minutes later. 4 different reporters, each known for investigative journalism, each given different aspects of the story to prevent any single outlet from being pressured into silence. The federal agencies were next. Medicare fraud, drug trafficking, OSHA violations. Each department received evidence specific to their jurisdiction. I'd researched the exact protocols for reporting each type of violation, ensuring that every piece of evidence would be properly processed and investigated. But the most satisfying delivery was to the hospital's board of directors. I discovered that the board met every Tuesday at 7 a.m. in the executive conference room. I positioned myself in the parking garage before dawn, waiting for the right moment. As the board members arrived, I approached each one individually, handing them manila envelopes containing summary reports and key photographs. Their expressions ranged from confusion to alarm as they realized what they were looking at. By the time they reached the conference room, half the board was already on their phones, likely calling lawyers and public relations firms. The first news van arrived at 9:15 a.m. I watched from across the street as reporters set up their equipment, preparing for what would become the biggest scandal in the hospital's history. The health department inspectors arrived 20 minutes later, followed by federal agents in unmarked cars. My phone buzzed with a text from Linda Chen. The hospital was in chaos. Administrators were being escorted out by security. Computer systems were being seized. Patient transfers were being arranged as departments were shut down for inspection. I allowed myself a moment of satisfaction as I watched Dr. Hayes being led to a patrol car in handcuffs. She moved with the same arrogant confidence she displayed during our final encounter, but her hands were shaking and her face had gone pale. Morrison followed 20 minutes later, his nervous finger drumming replaced by the metallic click of handcuffs. He'd lost weight in the weeks since my termination, his suit hanging loose on his frame. The stress of maintaining their deception had clearly taken its toll. The afternoon brought more arrests. The pharmaceutical buyers I'd identified from Dr. Hayes' safe were rounded up in coordinated raids. The off-site facilities where stolen medical supplies were stored were raided simultaneously. The entire network that had cost me my job was collapsing in spectacular fashion. Local news coverage was extensive, but it was the evening report that delivered the most satisfying moment. The anchor announced that the hospital's CEO, Margaret Thornton, had been arrested on charges of conspiracy and fraud. The same woman who'd signed my termination notice was now facing federal charges that could result in decades in prison. I sat in my apartment, watching the coverage with a cold satisfaction that surprised me in its intensity. The fury that had sustained me through weeks of planning was transforming into something else. A sense of justice served, of balance restored. But the story wasn't finished yet. The follow-up investigations revealed the full scope of the corruption. The hospital had been systematically defrauding insurance companies for over 5 years, diverting millions of dollars in reimbursements to personal accounts. Patient care had been compromised to such an extent that the facility would likely never reopen. Dr. Hayes' pharmaceutical network had been supplying opioids to dealers throughout the region, contributing to overdose deaths and addiction crises in multiple communities. The federal charges included conspiracy to distribute controlled substances, a charge that carried a mandatory minimum sentence of 20 years. The medical waste violations were so severe that the EPA classified the hospital as a Superfund site. The contamination had spread to the surrounding groundwater, affecting nearby residential areas. The cleanup costs would run into the tens of millions, effectively bankrupting the hospital's parent corporation. But the most satisfying revelation was the discovery of systematic patient abuse. The mortality rates I documented weren't just the result of negligence. They were the product of deliberate actions to reduce costs and increase profits. Patients had been denied necessary treatments, given substandard care, and in some cases actively harmed by the very people entrusted with their well-being. The class action lawsuits began within weeks. Families of patients who died or been harmed by the hospital's practices sought compensation for their losses. The legal proceedings would drag on for years, but the financial damages would ensure that none of the conspirators would ever recover their former wealth or status. I received a call from the district attorney's office 6 weeks after the arrests. They wanted me to testify in the federal cases, to provide first-hand testimony about what I'd witnessed during my employment. I agreed without hesitation, knowing that my testimony would help ensure the maximum possible sentences for those who destroyed so many lives. The trial preparation gave me the opportunity to fully document the scope of their crimes. Working with federal prosecutors, I provided detailed timelines, organizational charts, and evidence chains that painted a comprehensive picture of the conspiracy. Every photograph, every document, every observation from my 3 years of employment became part of the prosecution's case. Dr. Hayes was the first to be sentenced. 35 years in federal prison, with no possibility of parole for the first 20. The judge's comments during sentencing were particularly satisfying. He noted that her actions had not only betrayed her oath as a physician, but had directly contributed to preventable deaths and suffering. Morrison received 28 years, his cooperation with prosecutors earning him a reduced sentence in exchange for testimony against his co-conspirators. CEO Margaret Thornton was sentenced to 42 years, the harshest penalty of all. At 63 years old, she would likely die in prison. The other administrators and conspirators received sentences ranging from 15 to 30 years. The pharmaceutical buyers were prosecuted separately, with most receiving sentences of 10 to 20 years for their role in the drug distribution network. The financial penalties were equally devastating. The hospital's parent corporation was forced to pay over $200 million in fines and restitution. The individual conspirators were ordered to forfeit all assets acquired through their criminal activities, leaving them financially ruined in addition to facing decades in prison. But the most meaningful outcome was the policy changes that resulted from the scandal. New regulations were implemented to prevent similar corruption in healthcare facilities. Oversight procedures were strengthened. Whistleblower protections were expanded to ensure that employees who reported wrongdoing would be protected rather than terminated. My own legal situation was resolved quietly. The wrongful termination lawsuit I'd filed against the hospital resulted in a substantial settlement, enough to ensure my financial security for the foreseeable future. More importantly, the settlement included a provision requiring the hospital to acknowledge that my termination was retaliatory and unjustified. I found new employment at a different medical facility, one with robust ethics policies and transparent operations. The administrator who hired me was aware of my role in exposing the Riverside corruption, and she made it clear that employees who reported wrongdoing would be protected rather than punished. The work was familiar, but my perspective had changed. I no longer saw myself as invisible or powerless. I understood that my position gave me unique access to information that others might miss, and I accepted the responsibility that came with that knowledge. 6 months after the trials concluded, I received a letter from Linda Chen. She'd been hired as a nursing supervisor at a different hospital, and she wanted to thank me for the courage to act on the evidence she'd provided. Her words were simple but meaningful. She'd been afraid to speak up alone, but my willingness to take action had given her the strength to do what was right. I keep the letter in my desk drawer, along with newspaper clippings from the trials and a copy of the wrongful termination settlement agreement. They serve as reminders of what can be accomplished when someone refuses to accept injustice, when they choose to fight back rather than fade away. The final irony wasn't lost on me. They'd fired me to protect their secrets, but in doing so, they'd created their most dangerous enemy. A cleaner who knew their facility better than they did, who had access to areas they'd forgotten existed, who had the patience and determination to gather evidence methodically and systematically. They'd underestimated me because of my job title, my uniform, my perceived social status. They'd seen me as disposable, forgettable, irrelevant. But they'd forgotten that the people who clean up after others often know the most about what really happens when no one else is watching. I still work the night shift, still move through hospital corridors with quiet efficiency, but now I carry myself differently. There's a confidence in my step, a knowledge that I'm not powerless, that I'm not invisible. I'm a guardian of the truth, a protector of those who can't protect themselves. The administrators who betrayed me learned too late that respect and dignity aren't determined by job titles or social status. They're earned through character, through the courage to do what's right even when it's difficult, through the willingness to stand up for others even when it comes at personal cost. They thought they could destroy me because I was just a cleaner. Instead, they discovered that I was exactly what they should have feared most. Someone who saw everything, remembered everything, and refused to be silenced. In the end, that was enough to bring them all down. I was a cleaner fired without cause until I found evidence of their health code violations. Now I'm the man who cleaned up the corruption they thought they could hide forever. And every night, as I walk through sterile hallways with my cart and my mop, I remember that justice isn't about power or position. It's about the courage to act when action is required. The score was settled. The truth was revealed. The corrupt were punished. And somewhere in a federal prison, Dr. Patricia Hayes finally understands that the janitor she dismissed so carelessly was paying attention to everything she did. That knowledge, I imagine, makes her nights as sleepless as mine once were. But now I sleep peacefully, knowing that justice was served by the very person they thought was powerless to stop them. The cleaner who saw everything, the man who refused to be silenced, the individual who proved that truth and persistence can overcome any conspiracy, no matter how powerful or well-connected. I was a cleaner fired without cause until I found evidence of their health code violations. Now I'm the man who cleaned house.